Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. In this issue of Dentistry and You, we're going to discuss a very hot topic. The issue is silver amalgam. Silver amalgam fillings. Well, what are they exactly? Silver amalgam fillings are those silver fillings that are placed in your mouth. Most of you all have had dental appointments, visits where you had fillings placed in your mouth, and that means that most likely you have silver fillings, silver amalgam fillings. So what's all the big issue about it? Well, silver amalgam is an alloy. One of the constituents of that alloy is the element mercury. Now, most of us know that mercury is a very toxic element. But when it's combined together with the other constituents of silver amalgam, it forms a very stable and safe filling material. Yet, there's still quite a lot of concern about it. And most of you know that last month there was an issue on a show on CBS detailing out a lot of the public concerns about silver amalgam, and a lot of people became quite concerned about this. So, with me today to talk about this is Dr. David Moore from the University of Missouri Kansas City School of Dentistry. Thanks for coming down and welcome to Kansas City Alive.
Thank you, Buford. Nice to be here.
Doctor, there's a lot of points that we could cover about this. A lot of historical things about silver amalgam. Gosh, it's been around practically as long as dentistry's been around, at least modern dentistry. What can you tell the people at home about the safety of this material and why it's so important as a dental filling material?
First of all, I would like to say that this is not a new controversy. Just about 150 years ago, the dentists were worried about the mercury, and in 1840 to 1850 there was a time of controversy called the Amalgam War. And I will say that through the years this material has been proven to be very safe, very effective. It is the most often used, the most durable, the cheapest, most economical material that we can have for our patients. And I thought I perhaps would show your viewers exactly what we're talking about. When you go to the dentist, he will have a pellet or a capsule, something like this, and in this capsule is some silver, copper, zinc, and tin. It's a powder of metal,
right, and
a little drop of mercury. And you put this in a mixer, mixes it up, and it comes out a plastic mass. Now this little bit of silver is soft in the beginning. You can press it in the tooth, and it can take the form of the tooth, be polished. It gets very hard, durable, and then this particular piece is hardened. Now, as we look at it, with our new sophisticated measuring devices, we can measure that there's a very slight amount of mercury vapor coming off of this little piece of amalgam.
Just how slight is that slight amount? That's the issue.
All right. It is measured in parts per billion.
Parts per billion.
Billion with a B.
Not million.
Not million.
Billion.
Billion.
That's a pretty small amount.
Small. Now, in a one-day time of chewing, a person might have less than 1/2 part per billion of mercury vapor coming off of their restorations. And so basically, the program you referred to, the 60-minute program,
yes,
I believe was made, as a matter of fact, it made me feel a bit nervous, the way it was presented.
Right.
But as a matter of fact, there's no scientific connection between mercury and any of the diseases that they talked about, for any disease for that matter.
Of course we know that, and you've studied this even much more than I have. I've been in the business for 8 years, not including my 4 years in dental school, and I'm aware of what a wonderful material it is, and it kind of hurts to see, I'm not going to use the word irresponsible, but maybe rash journalism to stir up the public about something that really is a very tried and true material. And I would like to remind our people out there that are watching, this is a call-in segment. If you have any questions about silver amalgam, and there's a good chance that you have these kinds of fillings in your mouth, if you have a question, for gosh sakes, call us. I'd be very happy to entertain your questions, and Dr. Moore would be very happy to entertain them as well. So please call. The number should appear at the bottom of your screen. You know, that's a very good point about silver amalgam. It has been around a long time, yet I do get a lot of people that have shown a great deal of concern about it. In fact, on very rare occasion, some of them have actually asked me to have them removed from their mouth. Now, I don't like doing that because I don't think it's a very conservative process. But what possible advice could you give us, give to the public about such considerations, whether or not they should do this or not?
Well, of course, I recommend, and we recommend at the school, that patients do not have their silver fillings removed for this purpose. When they're good, they're functioning, not causing a problem, they should not be removed. Now, the fears that people have are real. And on this the 60-minute program, there were a couple of patients who, one lady who had multiple sclerosis had some silver fillings removed, and immediately the symptoms disappeared. And there are another lady with arthritis. And what these, however, show are the spontaneous remission of symptoms that occur all the time. And may I tell you a very quick story? We sometimes call this the placebo effect. The physician knows that 40 to 50% of his patients in a study, symptoms of all kinds will disappear, 40%, 50% with sugar pills.
Yes.
Now, we treated cervical sensitivity, people who had very sensitive teeth, cold water, their teeth were sensitive. And so we picked these people and we were testing out a material to try to relieve that. And we used this material on one side, we used distilled water on the other side. They didn't know it. We put it on with a brush. 40% of that pain was alleviated by distilled water.
It's all in the mind.
Well, the mind is very, very an important part of health.
David, we've got a couple of phone callers that are waiting and just dying to talk with us. So please go ahead. You're on the air.
Hi. The reason I'm calling is that I have never before had sensitive teeth, and recently I had a few fillings put in, and one tooth remained very sensitive. I went back, and the dentist said that he had not put enough base in under the amalgam.
Yes.
And that's why my tooth was very sensitive to cold. It's been fine up until recently when it's gotten sensitive again. Do I need to go back and have them look at it again, or possibly have them take it all out and start all over again?
How long has it been since the restoration the filling was put in?
April.
In April. Well, normally it is normal for teeth to be sensitive after all kinds of different kinds of fillings are put in. The sensitivity normally gets less and finally goes away. If it continues to be sensitive, or if it increases in sensitivity, I would certainly go back. Now, in April, if it is still sensitive, I would go back and he will probably check your bite and try to find out what's causing the sensitivity.
There are a lot of factors involved.
Yes, and it would certainly not be the silver amalgam that would cause that.
It would be the lack of base?
Well, it could be a lot of reasons. You could have a little leakage, could be the bite. The tooth may have been very deep in the beginning.
It was very deep, and the tooth right now is very sensitive to even real cold water.
It may just take it a longer time to heal. You know, if you have a very deep cavity, it takes longer for the sensitivity to go away.
I had a silver amalgam filling in a premolar that stayed sensitive for 3 or 4 years.
Yes, it can
and it
happen.
did finally get better.
Well, good. Don't tell me it's going to stay this way for 3 or 4 years.
No, as a matter of fact, it wouldn't hurt to go back and have it checked again if it hasn't gone away in 3 or 4 months.
Okay. Thank you very much.
You're welcome.
Thank you. Do we have any other phone callers out there that would like to talk with us?
Yeah.
Please go ahead. You're on the air.
I have a question about the mercury that's released into your system daily through your fillings as you chew. You say you can measure that amount and it's very minute. What about if, like me, you have a mouthful of fillings every tooth? Wouldn't there be a lot more mercury being released? And shouldn't I be more concerned about it?
There would certainly be more, but I don't believe you would be concerned. Now, a very recent study was done of people who they put, I believe, an average of 8 fillings, and they followed these people for a period of a year, and there was no increase in the mercury in their blood, you would have to have an awful, well, you couldn't have enough silver amalgam in your mouth to get it up even to, to any significant level. There has been a safe level determined, and it just would be impossible to get it that way. As a matter of fact, the food you eat, particularly seafood, the water you drink, has more in it. If you eat one seafood meal a week, you would have as much mercury in your system as from a mouthful of silver fillings.
I have one more question.
Please.
The American Dental Association doesn't appreciate all this
Wouldn't say
riffraff about the fillings. Why, if there is any danger at all, why do we not just go to porcelain? Is it just because it's more work to put in?
No, you've asked a good question. There seems to be, first of all, if you stop and think a minute, it would be to the dentist's advantage and the American Dental Association's advantage if we suddenly threw away amalgam and said we're going to have to take these all out because it would make us lots of money. Every other material is more expensive. And if I take out a silver filling in your mouth and put a simple plastic or composite filling, it would be nearly twice as much. It would cost you nearly twice as much. Now, in answer to your question, the reason that the American Dental Association has come out the way they have is that because there's no evidence of that toxicity. See, the material is toxic, but not at the levels that we find it in our mouths. And I know that's hard for us to understand. It's a matter of the fear is there. But I will tell you there's never been a larger population for us to examine, because literally everybody, millions and millions of people have these in their mouth. Dentists do take these out, and it's ethical to remove amalgams if the patient demands it. It is not ethical for me to tell you your fillings are toxic. I have to take them out.
as a means of obtaining an ends.
That's right. Now, I will tell you that there's quite a famous case. A dentist's license was lifted because he promised, he said, we take these fillings out and your whatever the disease was, I think MS will disappear. It didn't happen. And the lady now is suing the dentist. He gave her false hope. And so, obviously if there was any indication that this was toxic to an individual, the American Dental Association would be the first to say, let's quit this, let's get these out.
One more question.
All right.
Is there any explanation then for the people who were on 60 Minutes and the results they had after taking theirs out?
Yes, and I will tell you that. Do I have time to read this little?
Sure, please go ahead.
This is from the American Society, National Multiple Sclerosis Society, and Stephen Reingold, a PhD, Vice President in charge of research and medical programs. And just part of what he said, he wrote this to 60 Minutes. He said, you should have put a neurologist on who deals with these people. And he says that, he goes on and says, MS as a disease existed before the use of such materials in dental care. There are tens of millions of people with such fillings who do not have MS, and there are people without such fillings who do have MS. You could have interviewed a person with MS who went to the extraordinary expense, not generally covered by insurance, of having amalgam fillings replaced, but who had no benefit. See, so what I'm saying is these particular individuals benefited from the placebo effect.
And don't you think there was a lot of misconceptions from the 60 Minutes staff about this as well? Perhaps they didn't understand a lot of the factors, and there's a lot of sensationalism that goes in with journalism. Maybe that's fair to say, with all due respect to them. And I want to tell you, I really do appreciate your call very much. We do have another phone caller, so please.
Thank you.
Yes, you're welcome. Please go ahead. You're on the air. Please go ahead.
Hello?
Yes.
Yes, I had a filling put in about a month ago. And last week the filling cracked, and a piece fell out. And my tooth is cracked. So it's still a piece of filling still in, and a piece is out, and the tooth is cracked. And on one side, the inner side, the tooth, I can move it. And it hurts. So do you think
Yes.
this filling that's left inside is making my head hurt? Because I've been having headaches since then.
You need to get right back to the dentist very quickly and have him replace that. Occasionally, fillings do crack because of the bite for various reasons, but you don't want to leave it in that condition very long. So I would call right now or tomorrow and make an appointment to have that redone. It can be replaced so that it won't break.
I would say any kind of a pain, whether it's an ingrown toenail or a hurting tooth, will make my head hurt. So
Yeah.
I can appreciate that very much. But you should
Absolutely.
have good dental care and follow up on things like that. It's very important.
Well, do you think I should just have the tooth removed altogether because it's cracked?
No, I would not say.
No?
You want to save that tooth because it serves a purpose of keeping the other teeth in line, both the ones that are around it and the ones above it. You take one tooth out, it can affect 3 or 4 other teeth.
Yeah.
And there's nothing like real teeth.
That's
There's
right.
just nothing quite like it when it comes to a nice juicy steak. You
Right.
can really sink your teeth into it. And of course, nothing against dentures. Many of our citizens wear dentures, but there's just no replacement, no real good replacement for your permanent teeth. So for gosh sakes, do everything you can to save them because they're counting on you and you're counting on them.
Okay.
Yes.
Thank you both.
Thank you. Thanks for calling. Well, you know, it is a very interesting point about silver amalgam fillings. They are the mainstay in dentistry. That's the majority of procedures that I do, although I do a wide variety of other fillings. If a person came to us and said, I want my silver amalgam fillings removed, not just because I was concerned about the fact that there might be some minute contamination, whether it is a problem or not, but I'm concerned about the appearance. I'd like something that looks natural. What alternatives do we have for people?
We do have some, as you know,
Right.
some good alternatives. They're getting better all the time. We have tooth-colored plastic materials called composite resins and porcelain.
Right.
The viewers most likely have heard of dental bonding, cosmetic dentistry. We can now etch the tooth and actually bond materials to the tooth. And we can bond porcelain and plastic to the teeth. And it's a wonderful thing, and there are various things. The only problem with porcelain and plastic, it breaks more often than the metals. And then the old standby gold.
Right.
The gold crowns, and the gold can be covered with porcelain to make it look like a tooth. So we do have a lot of other alternatives, all of which very fine, but they are more expensive than our old standby silver amalgam.
I think I'd also like to point out to the people at home, with my own personal experiences with composite plastics and porcelain inlays and porcelain fused to metal crowns, I have found, now not maybe there's a different set of problems with porcelain fused to metal crowns, but what I have found that I get a tremendously variable set of results with the composite resins, all the way from very excellent aesthetics and very good, well-placed fillings to some that don't work out so well, even over a year's time. And it's a little disconcerting because as dentists, you know, we like everything to go perfectly, even though it isn't always the way it is. But I find with silver amalgam, by and large, if you want to look at the odds, my odds of placing a better filling that's longer lasting are much greater with the silver amalgam. And that's why it is the filling material of choice for me, especially if it's not going to show a lot. And that's why I think it's very important, and I think that's why not only should dentists be vocal about it, but I think the public should be aware of the fact that it is a safe material, that it has been tried and true. All the way since the beginning of modern dentistry, we've used them. In most cases, they'll outlast the tooth that they're placed in, and that's an important fact, too. So I guess basically what we need to do is look at it rationally. The public needs to look at this rationally and not necessarily believe everything that they read or see on television, and perhaps maybe listen very closely to what their dentist says or the dental profession says, and not consider that we're just simply saying it because we have our own personal interest in mind. The whole point is that we have the patient's interest in mind. I don't think any doctor would place, whether it be a surgeon, oral surgeon, physician, dentist, would do anything that they knew was knowingly hurting a patient. Even if they had the slightest concern about it, I don't think they would do it. We have 2 minutes left. David, what would you like to say about this?
Well, the other thing I think which is exciting to me, really, is that we are now having a lot of improved materials.
Yes.
It could very well be that in the next few years we will have materials that will be as good as the amalgam that do not contain mercury. And I would say to the viewers, if they really are concerned about it, tell their dentist and don't use it. You can use gold or porcelain or composite, and if it makes them feel better, to just not have it in their mouth. But I would also like to say it's a very, very safe, tried and true material.
Well, I think that's great. And I would also say to those people out there at home watching this, if you have any questions whatsoever about the safety of this, call your dentist. He'll be happy to talk to you about this. It's very, very important that you be properly informed before you make any rash decisions or make decisions about what you want to have happen with your mouth, because it's very, very important. Remember, your teeth are counting on you, and you're counting on your teeth to make the proper, rational decision. And again, I want to thank all of you for watching my segment, Dentistry and You, and watching Kansas City Alive here on KCCP television. And when we come back, you'll find out what's on Wednesday's Kansas City Alive.
If you were creating a place for your children to live, wouldn't you make sure it provided everything they'd need to grow up healthy and happy? Well, the fact is, this is where your children will live, and you can help protect it. You can recycle glass, plastic, and aluminum. You can organize neighborhood cleanup efforts. And you can write to take pride in America for more ways to help preserve the earth. After all, some pretty important people are moving in.
Well, that's it for Metro News, Sports, and Weather. I'm Bob Renison. Coming up on the rest of Kansas City Alive, Dr. Buford Casebolt will be here with Dentistry and You, and tonight he'll focus on children's dentistry. The phone lines will be open, so get your questions ready.
Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight, I want to talk about something very important, children's dentistry. Now, it happens to be the month of February, and February is National Children's Dental Health Month. Of course, I think that every month is a good month to talk about children's dentistry. But we'll talk about it very sincerely tonight because it's very important. And I'd like to remind all of you out there, this is a call-in segment. If you have a question about children's dentistry, if you're a parent, if you are a grandparent and you have little grandchildren, if you are an aunt or an uncle and you have a niece or a nephew, give me a call. I'd love to talk with you. One of the most often asked questions that I get about children's dentistry is, when should I bring my child in for dental care? Well, anytime's a good time. I always suggest that they should come in with their parent at an early age of 2 years old, 2 years of age. They can come in, become familiar with the dental surroundings. Remember, a dental office is a rather unusual place. It's not like being at home. There's a lot of big equipment. There's a lot of unusual sounds. There's a lot of people walking and running around and doing things. A child can become very accustomed and very comfortable with the dental office if they come in at an early time when their parents come in for their dental appointment. Let their teeth be looked at. It's great. Children really love to do this. They like to open wide and have the doctor look in there, peer in, and say, "Ooh, what a nice set of teeth you got." And it's a good time for the dentist to talk to the parents about what the parents need to do to foster good dental health. And that leads me to the next question that's often asked. What should I do to help my child take care of their teeth at home? Well, first of all, when a child gets teeth, and that's usually within about the first year of life. And keep in mind, every child's a little bit different. No one child is the same. So don't get too worried if a year goes by and no teeth are present. Then again, in some cases, some children are born with teeth. Every child is different. so don't be too worried about that. As soon as they have teeth, they need to be brushed. At 1 year of age, you can start with a very, very small toothbrush, and there are a lot of good ones on the market. Remember, those little teeth require little toothbrushes, and always make sure that they have one toothbrush that is their toothbrush and the one that they like to use. Just have to put a little bit of toothpaste on it. That's all that's necessary. Just a little drop for those little ones. And help them brush. A child doesn't come into the world knowing how to brush their teeth. You have to help them. You have to show them. And when you brush your teeth at night, let your child see you brush. They like to imitate their parents. When they see their parents brush, they're going to want to brush. And that's a great thing because that fosters good dental health with our children. And again, I want to remind all of you out there, if you have a question about children's dentistry, any question, I'd love to hear from you. And I'd also like to mention the answers that I give you to your questions are, in my opinion, I am a registered dentist in Kansas and in Missouri, and I feel very confident about answering your questions. But remember, these questions are, in my opinion, at my professional discretion. So I'd like to mention that as a disclaimer. Another question that I often get, a parent will ask, my child is 2 years of age, he's 3 years of age, and he hasn't gotten all of his baby teeth yet. Or better yet, my child is 6 or 7 years of age, and he or she has not gotten their permanent teeth yet. Well, I always answer that question more or less, don't worry about it too much. Every child is a little bit different. But there is a guide for the eruption pattern of permanent teeth. First of all, by the age of 2, a child should, I say should, have all of their baby teeth. There is some variability to it, but by age 2 they should. Not until a child is 6 to 7 years of age do they start seeing a big change in the mouth. The child is growing a lot by then. There's been a lot of changes. Their jaws are growing. Their permanent teeth that have, by the way, been in place in their jaw since a very early age of 1 year are just now getting to the developmental point where they want to come in and replace some of the baby teeth. Now, I have a couple models that I'll show you. We'll start with this one here. Now, this model is of the lower teeth, a child's lower teeth. And if you look here, you see the baby teeth here. Now, in most cases, the very first teeth to be replaced are the lower central incisors, these teeth here. These are referred to teeth O and tooth P. They are generally the very first teeth to be replaced, and about from age 5 to age 6 are the ages that we'll see these teeth replaced. They'll get a little loose. The child might complain that, gee, Mom, my teeth don't feel right. They kind of hurt. And when I bite down, they wiggle around and move around. You might even notice a little bit of bleeding. That's not unusual. Remember, there are permanent teeth down in the gums here, down in the bone, down below here, and they're pushing their way up. Eventually, tooth O and P are lost. And within a short period of time, you can see the permanent teeth begin to push their way up. This is the normal eruption sequence. Now, I'll bring the other cast up here. This is the upper cast. These are the child's upper teeth right here. Now, we'll put them together here so you can see them as a set. The next set of teeth to erupt properly, let me get them aligned properly. Now, that's much better. The next set of teeth are the upper central incisors, tooth E and tooth F. Baby teeth are listed in alphabetical order, whereas permanent teeth are listed from tooth 1 to tooth 32 by numerical order. Tooth E and tooth F are the next teeth to be lost and replaced with tooth 8 and tooth 9, the central incisors. This happens shortly after the lower central incisors are lost. It doesn't take very long to start seeing this sequence. From about age 6 to 7 to age 8, almost all of the upper and lower incisors, that includes the lateral, the two centrals, the lateral over here, and of course the lower lateral and central incisors, eventually become loose they fall out, and as we say in dentistry, they're exfoliated in favor of the permanent teeth. Now, this goes on for a period of time. Now, it's interesting to note, about age 6, another interesting thing happens. The patient's, the child's 6-year molars start to come in place. Now, 6-year molars are permanent teeth. They are non-succedaneous teeth. Now, what does that mean? That means that they came in not replacing permanent teeth. Now, you might notice in your child's mouth if you look in with a flashlight, and I suggest you do that. It's an interesting experience both for yourself and your child, because you get in tune with their mouth. You know what's going on. And you should look from time to time. It's always a good idea. At about age 6, you'll notice 2 bumped out or swollen out areas back behind the second baby tooth molars. Now, we'll look back on our cast here so that you can see. I'll use the upper cast here, and I'll turn it over. These are the baby teeth here. The 1st or 6-year molars come in these areas right here. And you'll notice little bumped up areas. Sometimes if you reach in the mouth and you press on those areas, you might even get a little bleeding there. That means that those permanent teeth are beginning to erupt into place. And this is normal. Age 6 to 7 is a very normal time for this to happen. Now, another thing that's interesting happens in the eruption sequence. We are pushing through the ages now to age 6, 7, and 8, and even to age 9. Some other interesting things begin to happen. The primary first, here's a first molar over here, and primary second molars begin to erupt into place. That is the next process. And there is a long range of time, anywhere from age 10 to 11 to 12. These teeth could begin to erupt. Now, this is an interesting time because the chewing teeth, the teeth that are responsible for chewing heavy foods, become loose. And sometimes a child will complain of discomfort. Now, at this time, it is important to note that they're getting their premolar teeth. And that's very important because these premolar teeth are the replacement for those molars, those primary molars. And that's very, very important. And I understand that we have a caller on the line. Please, go ahead. You're on the air.
Yeah, my son.
Yes, you're on.
Yeah, I've got my son here, and he's got a blue spot on his tooth.
Yes.
It's like over the tooth. I don't think the tooth is coming out.
How old is your son?
6.
He's 6 years old. Is it in the center of the tooth?
Yeah, kind of. It's on top of it, like.
Okay. Is this a back tooth or a front tooth?
In the back.
It's in the back. Okay. Is it on the surface where he'd ordinarily chew?
Yeah.
Okay.
Yeah, it's covering it like it's on the side.
Okay. Has your child seen a dentist yet?
No. I should take him in.
I think that's an excellent idea. You know, do you have an opportunity?
Do you know what it is?
Well, do you have an opportunity to go to a dentist yourself?
No.
Well, you know, one of the best things that I recommend, in fact, I was going to get to this question in a minute, you should always take your child in when you go. That way, especially at their first visit, it's real important because they see that Daddy's getting his teeth examined and he's having a good time. And he knows, hey, if Daddy's going through it, it must be okay. And that's always the way I recommend those first visits for your child. Now, I can't be sure, to answer your specific question, I can't be sure whether that's an area of decay or exactly what's going on. Sometimes the central part of teeth can become stained with just everyday foods. And the little grooves that are on the top of the teeth, where the teeth do the chewing, the back teeth do the chewing, sometimes are so fine, it's very, very difficult to clean those out with just normal toothbrushing. Now, I can actually show you on a model some of these fine grooved areas. They're so fine, there's just no way that a toothbrush can effectively get in there. And that brings me to another point. A lot of times, because of that very fact that they're hard to clean in these areas, decay can work its way into these areas, and the tooth will decay. And that might, I'm saying that might be the issue here with your son's tooth. I would recommend that you have him go in for a routine dental checkup and have those teeth checked out thoroughly. If it is a small cavity, a lot of times a very, very simple process can be instigated where the teeth are just cleaned out slightly and a little bonding agent can be placed on. It's very comfortable, it's a very easy procedure to do, and it's very non-traumatic, and it makes those first visits for your child very positive and good visits.
Could you recommend a place where I could go?
Well, generally what I recommend is that you ask a friend who they take their children to. That's one of the best recommendations. If their children like their dentist, then that's a good bet. You should go and call that dentist, get the phone number from your friend, or if they just have their name, look them up in the white pages. They're generally listed there. And for gosh sakes, make an appointment, get in there, and have your child's teeth looked at.
Okay, thanks.
Thank you, and thanks for calling me. We have another phone caller. Please go ahead. You're on the air.
Yes, my question is, what's the best way to teach a child to brush regularly, to get him in the habit?
That's an excellent question. The best way is see and do. If they see their parent brushing their teeth, they know it's a good thing to do. Children really mimic their parents, and that's a wonderful thing. I have 2 children myself, and I always draw attention to the fact that, hey, Daddy's in there brushing his teeth, and he knows it's important, so you need to get in there and do the same thing. That does bring me to another issue also. Sometimes children don't do a real thorough job, and you have to lend a helping hand. You need to get in there, use your hand, help guide their hand with that toothbrush. And remember, they need to have their own personalized toothbrushes. The ones, you can even put their little names on it if they like, if you have more than one child. Remember, it's important that they know where that toothbrush is, it's their toothbrush, and that they have a responsibility every night before going to bed to make sure that their teeth are clean. And again, it doesn't take very much to get your children in the habit of doing that. And that's a real important thing, because once they're in the habit of doing that, they're used to doing it. And that follows through with them for a lifetime. And I think that's a real important point. Did I answer your question?
Brushing.
Yes. Please go ahead.
What is the earliest age you would recommend getting your child to start brushing?
As soon as they have teeth. And this could be at most any time from age 6 months to a year on through life. And the sooner they get used to it, the better they are.
Okay. Well, thank you very much.
And thanks for calling.
Bye-bye.
You know, I was going to touch on the issue of children's toothbrushing. You know, it is very important to have a toothbrush that's designed for children. I have several toothbrushes here just to give you an idea of the difference in size. Now, the one on the right of your screen is a toothbrush for adults. That is a typically sized toothbrush. It works very well for adults, but in our children's mouths, it doesn't work out very well because those mouths are kind of small. Now, I'll bring this one closer. You can see how much smaller the orange toothbrush is. This one is specifically designed for children's teeth. As a matter of fact, this is my son's toothbrush, and I have to get it back to him tonight, so I'll have one to brush with. But I thought it was a good example, so I brought it with me. Again, a child's toothbrush should be small and should conform very nicely to those baby teeth. And I'll actually show you. I'll bring the model over here. Children's teeth have an interesting advantage over adult teeth. They are smaller and they're easier to clean. And that's a good thing. Adult teeth are larger and have more surface area between them, and that makes them more difficult to clean. That's why adults have to use dental floss. Now, when children brush, it's important that they be thorough. It's really easy to give them a lick and a promise. Go over the front ones real quick, spit out, and that's it. Well, that's not thorough cleaning. Children need to know to be thorough. They need to take that toothbrush and reach back to those back areas with a little pressure and motion like this. They don't need to scrub the teeth, but they need to get all the surfaces and all the areas thoroughly. And they need to come back around here and get the areas also. Again, it's really important to be thorough. And again, as I said before, if you lend that helping hand, you can be sure that they're doing a thorough job, because you as the parent of your child have that responsibility to make sure. It's easy to miss areas, especially those back teeth. And one other thing, and this is important. I would never tell a parent that they should deprive their children of sweets. At least hardly ever. I think candy bars, things of this sort, they kind of go hand in hand with children. I know I have a sweet tooth and I haven't given up candy, but I know, and I tell my children, if you eat sugary and sweet foods, you fuel the bacteria. You provide them with a nutrient. And once the bacteria have the necessary nutrients, they reproduce, they produce plaque. Plaque burns the teeth and causes tooth decay. It burns the gums and causes gingivitis. And this is a very bad thing. And this is why it's so very important if your child does eat sweets. And for that matter, I would include potato chips, corn chips, even baked potatoes, French fries, the bread on a hamburger bun. These are carbohydrate type materials. They can be just as bad as the sugars in sugary and starchy foods and candy bars and things like this. It's very important that they know when they eat foods like this, they have to pay a small price. They have to go brush their teeth. And that's real important because that removes the nutrients, the bacteria don't have a chance to get onto the teeth, produce plaque, and cause the burning tooth decay sensation. And I would say that to all people out there. Make sure that your children brush. Now, a good question also, how often should you change toothbrushes? Well, when they wear out. The toothbrushes I showed you were relatively new and they're in good shape. But you know, toothbrushes last a very long time. You know, I've noticed when toothbrushes are used over and over, they get kind of brittle or hard. I prefer soft bristle toothbrushes. I would say if the toothbrushes are getting pretty mangled, the bristles are all going in whichever direction, maybe that's a good time to change toothbrushes. They don't cost very much. What the heck? You'll spend more money on toothpaste itself. And one last point I'd like to make, fluoride rinses. I personally don't think they're that important. Fluoride is in the drinking water. It's in the toothpaste we use. Sometimes small children eat the toothpaste. That's why you shouldn't use a whole lot. What is important is that they remove plaque from their teeth and they get the necessary trace amounts of fluoride from the drinking water and the toothpaste. And that is very, very important. Again, make those first impressions of dentistry on your children very positive ones. Talk it up, be positive. Is very, very important. Your children's teeth are counting on you, and you're counting on your children. They are the future of our world. And with that, I want to thank you very much for watching my segment, Dentistry and You. Now, don't touch that dial, because when we come back, we'll find out what's on the next Kansas City Alive.
Here's tonight's primetime lineup on KCCP TV.